domain is clinical evaluation and diagnosis. Athletic trainers are trained to examine patients who have acute, subacute, or chronic musculoskeletal disorders and medical conditions. Athletic trainers must have a detailed understanding of musculoskeletal anatomy and the physiological response to injury and illness. Athletic trainers work closely with other healthcare professionals and can recognize when a referral is needed. During an exam of an orthopedic injury, athletic trainers obtain a thorough medical history, inspect the patient for signs of injury, palpate the injured site, and perform special tests. Each step of the evaluation is important in reaching a correct diagnosis. Skills an athletic trainer should possess in regards to this domain include the ability to perform a comprehensive exam, the ability to create an appropriate treatment plan, and the ability to communicate the results of the exam and treatment plan to the patient.
Athletic trainers are trained to perform injury evaluations. An easy way to assess an athlete is by utilizing the acronym HIPS, which stands for History, Inspection, Palpation, and Special Tests. As an athletic trainer, it is important to get as much information from the history portion of the evaluation as you can, because this can help you to determine what is wrong with the athlete. History questions can include: what happened? When did it happen? Where is your pain located? Rate your pain on a scale of 1 to 10 and previous history of injury. The second step is inspection. During this time, you are just looking for bruising, discoloration, swelling, infections, or deformities. Palpation is when you are hands-on making sure the bones, muscles, ligaments, and tendons are intact and not damaged. For this, it is good to compare bilaterally to feel a difference between the injured and non-injured sides. Lastly, we have special tests. During this process, you are assessing the athlete's range of motion, nerves, and completing special tests to assess what their injury could potentially be. There are special tests for different injuries in the body. For example, the knee has special tests to determine if you tore your ACL, PCL, MCL, LCL, and meniscus, to name a few. Overall, completing injury evaluations is a very important task of an athletic trainer. Once they have been completed, depending on the injury, the athletic trainer will talk to the athlete and decide if they should go to the hospital or if it is an easier treatment, such as an ankle sprain.